fear were fighting him and fighting reform and fighting progressivism in America. They called it then socialism. That's what they said about Social Security. They said it would break America. They said that everybody should not be included. In fact, these attacks so weakened the first Social Security Act. The forces of greed, selfishness, and fear and division fought so hard and brought so many souls that they forced coverage for the mostly black, Hispanic, and poor domestic farm workers to be taken out of that act before it was even passed. And it took 19 long years for these Americans to finally be covered when they turned 65, if they turned 65. The forces of greed, selfishness, fear, and division have a long history of promoting a divided America. They are good at it, they are loud at it, and they are consistent at it. But today we gather to say they have had their say. Now it is time for us who believe in a united America, a caring America, a compassionate America, to speak up. Tomorrow is my birthday. I was born 2 days after the March on Washington 46 years ago on yesterday. That was a triumphant day. That was a day when a prophet named Martin Luther King laid a challenge to these same forces in the nation's capital. He challenged the forces who were saying the call for justice and jobs and equality would cost too much for America. Dr. King said on that triumphant day, and we must say it now, we refuse to believe that the great vaults of this nation are bankrupt. And today I say we refuse to believe that we cannot pay for a just health care system. The forces of greed and selfishness, Lenice, and fear and division, Lenice, they can't have it both ways. When they demand more tax cuts for the wealthy that don't need it, somehow they find the money. When they want to bail out Wall Street and bankers and pay for extravagant CEOs, billion-dollar bonuses, the taxpayer dollars, they find the money. When they want to follow lockstep the leadership of a president who led us into an immoral and unnecessary war, they found trillions of dollars. But when it comes to caring for our own, for the 50 million Americans who can't pay for good health insurance, the voice of greed, selfishness, division, and fear want to tell us the funds are not sufficient. Well, you can't break the bank and rob the bank and just say there's no money in the bank. You can't say it costs too much today, knowing that it costs even more tomorrow if you don't fix it now. You can't, with integrity, be a senator or representative with the best retirement and health care in the nation, fight plans to help everyday Americans who need good health care. You can't, with integrity, accept Social Security and Medicare, which, in case if you haven't heard, are U.S. government programs to our friends across the street, and then go on television and say the government ought not help others to get health insurance. Something is terribly wrong with these positions. Yes, in a democracy we ought to have debate, but the debate ought to be logical, and it surely ought not be based on distortions and lies. So we're here to say we will not, we cannot, and we must not believe the distortions. Health care for every American now. That's what we believe. That's what we want. That's what we're fighting for. Too many Americans are straining under the burden of two related trends: shrinking health care coverage and rising health care costs. Over the last decade, millions of Americans have found themselves uninsured, and millions more have become underinsured as the value of their coverage has declined. In 2008 to 2010, it is estimated that approximately 6,000 people a day, or almost 7 million Americans, will lose their health insurance. Remember what Reverend Dr. King said 40 years ago: of all the forms of inequality and injustice in the health care is the most shocking and inhumane. So, my friends, health care reform is not calculated socialism, it's common sense policy. Tim Wise, a white social commentator, has said, by allowing the right to throw around terms like socialist to describe the president and socialism to describe his healthcare reform proposals without challenge is to ensure that the right will succeed in their demonization campaign. Wise said, and I agree, that this noise is about race. It's about othering the president. This is what animates every move of angry masses, individual exceptions notwithstanding, he said, and unless the left and people of goodwill push back and insist on a new way away, and that the old days are gone, and that white hegemony is dead and deserves its desires, and that if we pass healthcare reform, it will be good for all of us, red, white, and black, then they will win. But we're here today saying they will not win.
That's right.
I tell you where we must stand. If caring for all the people is socialist, then Amos the prophet was a socialist when he said, let justice roll down like water and righteousness like a mighty stream. Isaiah was a socialist when he said, loose the bands of wickedness and care for the poor among us. Jesus Christ, the non-profit healer, was a socialist when he said, the Spirit of the Lord is upon me because he's anointed me to preach good news to the poor, sight to the blind, and healing to the brokenhearted. If ensuring health care is socialist, then Ralph Waldo Emerson was a socialist when he said you cannot do a kindness too soon, for you never know how soon it'll be too late. If working for a just society that provides health care for all Americans is socialist, then the founding fathers were socialists when they enumerated in the founding documents of this nation that the purpose of government is to work for the common good, not just private prosperity. Healthcare reform is not socialism, it's social justice, and we must make it clear. We cannot allow the BOL, the bull, to run this debate. You know the BOL, the O'Reilly Limbaugh, Beck O'Reilly Limbaugh. Because they shout loud to drown out the voices of truth and compassion. That's why it's time to speak and act now. Say it. Healthcare for every American now. And we must take on every distortion and every lie. When they try to say there's a death panel in the current proposal, we must say no. There's not a death panel in the current proposal. There's a death panel in the current system. The death panel is a discriminatory system that's in place now. The death panel are the insurance claims adjusters who deny claims. The death panel is insurance companies who deny people because of pre-existing conditions. Those who set the cost of insurance that forces people to choose between food and paying rent and health insurance. That's the death panel. The death panel is keeping 1 out of every 4 Americans at the mercy of every illness, accident, or the loss of a job. And we must challenge it. But not only that, we must challenge those who are funded by insurance companies and healthcare industry. Democracy North Carolina research, according to my good friend Bob Hall, compiled from the Center of Responsive Politics for a Federal Commission, has listed the donations given to every member of Congress. Senator Richard Barber, for instance, leads the list, receiving $1,600,000 from healthcare and insurance corporations. Now, you know the NAACP is nonpartisan. I'm just talking about public policy.
That's right. That's right.
But we must say to him and every other elected official, no matter who gives you some money, your job is to care for all the people and help make life better for all the people. And we must challenge Democratic candidates who run on a progressive agenda, who say in the heat of a campaign that they stand for health care reform, that they stand with the late lion of the Senate, the Honorable Ted Kennedy, who championed full health care reform and said every American should have the opportunity to receive a quality education, a job that respects their dignity and protects safety, and health care that does not condemn those whose health is impaired to a life of poverty and lost opportunity. When progressive Democrats run and say they stand with the legacy of the lion of the Senate, we must challenge those who rode the coattail of President Obama, calling for health care reform. But somehow once they get elected, they try to move from being lions that will fight for real change to being blue dog Democrats who sniff around for the easiest compromise. We believe in bipartisanism, but we don't believe in a bifurcated health reform act that doesn't fix the problem and cover everybody.
That's right.
Why should we have to compromise on the moral rightness of health care for every American? So Senator Burr and Senator Hagan, no matter whose money contributed or what color the dog, donkey, or elephant is, conservative or liberal, we want health care for every American now. We, in the NAA, in the HK-on-J coalition, before this debate ever began 3 years ago, we called for health care for all in the third point of our 14th upon agenda. The NAACP has been calling for it for years because we know it works in America. Full health care coverage that is affordable to every individual, family, and business, which provides coverage for a pre-existing condition. Standard comprehensive health care benefit that meets everyone's needs from preventive to chronic care. The choice of a private or public health care plan, which includes a new public health care option that will provide a guaranteed backup, which will always ensure equity. And equity in health care access, treatment, resources to people and communities of color, and stronger services in low community. Health care is just like education. It's a fundamental human right in the 21st century. Systematic denial of health care to the poor, to working people, to people out of work, to the 50 to 100 million Americans who need health care the most, to the people with pre-existing disease is a sin. It's evil, it's wrong, it's unjust, it's not American, it is perpetuating a separate and an equal society. It is cementing a Jim Crow health system in place for another century. This, my friends, is the United States of America, the richest country in the world. We want an American healthcare system, not a system that works for the rich and is dysfunctional for everyone else. We want an American healthcare system, not a system that discriminates and excludes and picks and chooses who lives and who dies on the side of their bank account. The exclusive healthcare system works fine for those with good jobs and big bank accounts. But this is the United States of America. We need a United States of America healthcare system, the United States of America healthcare plan. And if you don't understand that, then you don't understand America. If my people who are called by my name would humble themselves and pray and turn from their wicked ways, and when I hear from heaven and heal their land. We need a healing. We need to turn from fear. We need to turn from greed. We need to turn from lies. We need to turn from selfishness. We need to turn from our wicked ways. We need a healing in the land. Too many children are dying. We need a healing in the land. Too many families are struggling. We need a healing in the land. Too many people are scared to get sick and can't go to the doctor. We need a healing in the land. We don't believe in social Darwinism, survival of the fittest. We believe we are our brother's keeper. We believe we ought to do unto others as he would have them do unto us. We believe that a great nation cares for all its people. We believe that when we lift up the poor and lift up hurting, the whole nation gets elevated. We believe that we reap what we sow. If we sow compassion, if we sow caring, if we sow mend our ways, then God will shed his grace on us. And so this is no time for us to stand on the sideline. This is no time for us to be quiet. We need a healing in the nation. Let every politician hear our voice. Health care for every American now. Go tell your friends. Go get your neighbors. It's time to stand. It's time to fight. We need a healing in America. Nothing will turn us back. This is the moral issue of our day. We love our foes, but we cannot follow their path. We need a healing in the nation now. If we turn, if we stand, if we speak, God will use our efforts and heal the land. We need a healing in the land.